All right. Welcome, everyone. Thank you so much for attending the Job Spotlight series for respiratory therapists. My name is Nicole Vall. I'm the Health and Science Program Manager for the Illinois Medical District, and I will be your host for this session. I'm going to kick it over to JR to introduce himself.
Hey everyone, thanks for having me today. My name is J.R. Pfeiffer. I am a registered respiratory therapist and now serving as a manager for the Northwestern Memorial Hospital respiratory team.
Great, thank you. So this is just an overview slide, just to please try to stay on mute. And if you have any questions, you can put those in the Q&A tab on Whova. And I will try to check that, pay attention to that during our discussion and towards the end as well. And then all of the job spotlights will be recorded, so you won't miss anything. Tomorrow you'll be able to go on and view those as well. So to start, we're just gonna give a quick overview of what a respiratory therapist is, and then we'll kind of go into some Q&As and open it up for any additional questions from the group. So a respiratory therapist, they evaluate, treat, and care for patients with breathing disorders and pulmonary diseases like asthma, COPD, or cystic fibrosis. They measure oxygen levels in blood, lung capacity, and stress levels. They also administer medications and monitor breathing using machines and medical tests. On the left here, you'll see kind of an overview of the respiratory therapist jobs. Their median wage in Illinois is just over $63,000. This is for Illinois, so there may be differences based on the specific location, like in Chicago, and I think we'll go into that in a little bit. So the number of respiratory therapists in Illinois is a little over 4,000. The annual openings in Illinois are just over 300, and the 10-year projected growth is 14.5%. which is, I think, typically faster than average. I think typically growth rate is about 5%. So you can see that's a really decent, fast growth rate there. And for education for respiratory therapists, there's a minimum of a 2-year associate's degree, but then you can also go on to get a bachelor's and master's degrees based on the specialty skills or area of care that you'd like to go into. So with that overview, we have a list of questions here that I'm going to ask JR. And as we go on, if you have follow-up questions or questions we don't get to, please feel free to use the Q&A. And we are a pretty small group, so we can even open it up to if you have questions at the end. So I'll leave this overview up to while we go through questions in case that triggers anything. So the first question is, how did you first become interested in a career in respiratory therapy?
Yeah, so I was actually in another field. I went to school for a bachelor's in technical systems management, which is an engineering degree. And I got into it, and I went into a different route than my degree was in. And so I was working in the restaurant business, and it just didn't feel as fulfilled as I wanted to be. And, I've always been a person that's wanted to help people. And so I had a friend of mine suggest that I would like respiratory therapy. I for sure did not want to be a nurse. I didn't want anything to do with anything below the belly button. And so I looked into it one night after a shift, and I was like, this makes sense. Like, this is something I would like. And the reason I really kind of gravitated towards it is I'm not a person that wants to do the same thing every day. Like, working in a factory or anything of that nature just really does not resonate with me. And I was looking for something that every single day was a little bit different. And in respiratory therapy, that is exactly what you get. And yeah, so I went and talked to the director of the program. I was living in Charlotte, North Carolina at the time. And I went and talked to him, and it sounded like it was a good fit for me. It took another year to get into the program, and yeah, couldn't be happier.
Great, excellent, thank you. So you touched on this a little bit, but what training do you need to become a respiratory therapist, and then where did you train?
Yeah, so I was in Charlotte, North Carolina at the time. That's where I happened to be living, and you need to get some gen eds out of the way, so general education classes out of the way. So some chemistry, some biology, things of that nature. because I already had a bachelor's degree, I had several of those already under my belt, but I actually had been out of school for 5.5 years and needed to have my chemistry within 5 years. So I had to go back and take another class. And so it takes about a year to get gen eds out of the way, general education classes out of the way. And then it's a 2-year degree after that. You can choose to go on further and, get a bachelor's or a master's, which is offered at another university within the Chicago area. But a 2-year degree and you're already at work and making a decent living.
Right, thank you. Where do respiratory therapists typically work, and what does a typical day or week look like for a respiratory therapist?
Yeah, so respiratory therapists work in a lot of different areas. There's rehab, cardiopulmonary rehab. There's hospital settings, which is what I'm familiar with the most. There's also a pulmonary function lab, which I'm actually one of the managers over as well. And so a lot of times you're dealing with in the ED with traumas, you're dealing in the ICU, you're dealing with medications. You have patients that have either COPD from smoking throughout their life or asthmatics and things like that. And so you really have a vast bandwidth within the healthcare system that you can work in. And personally, I am an ICU therapist. That's what I did for the most part, that and trauma.
Thank you. And so we have the medium wage for in Illinois listed up here, but in your experience, what's the salary range for respiratory therapists in Chicago? And is the role in high demand?
So the role is in very high demand right now. We do not have enough individuals that are in school that are able to fill all the open opportunities for employment. And in Chicago, at least at my institution, 65,000, closer to 70,000 is what you could expect to make in 1 year. That's without overtime. And in the current situation that we are in now, there's a lot of overtime that's available because of the pandemic. And honestly, a lot of the folks that are coming into the hospital now are much sicker than they ever were before, even including in my 11 years in the field. 5 years ago, or actually 3 years ago, from what we were seeing at that point to now is vastly different. And we've got a lot more volume and a lot more things going on. And yeah, I mean, you finish school, get a degree, get your license, all that stuff, you will have a job tomorrow.
Wow, that's great. What opportunities are there for respiratory therapists to advance their careers, and how did you advance into a management position?
Yeah, for me, I went to school in North Carolina with, like I said earlier, and I moved here because of my wife. She was already here and working, and I needed to come back to Illinois where I grew up. And I came back, and I started out as a staff therapist, and as a staff therapist, like I said earlier, you're making close to $70,000 a year, and I was interested in learning more than I was advancing. And after about 5 years into my career, I decided that I'm doing a lot of work that really makes sense, that I can advance and I can help out this program and this department. And so I started applying to advance myself. And so I went from a staff therapist to what we call in our department as a clinical coordinator, which is a leadership role. And then eventually I was approached and asked if I wanted to go into management, which I, was on the fence on, because management is definitely a lot of work. And I decided that, what, this makes the most sense for me and my family. And I went for it. And here I am today, about 5 years later, and couldn't be happier, couldn't be prouder of the things that we've done, especially during this pandemic, because as you all know, during the pandemic, this was a respiratory pandemic. And so respiratory therapists were on the forefront of everything. We made a lot of advancements in medicine. And yeah, this has been a great fit for me.
Thank you. What is the most rewarding part of your job?
I would I would say the most rewarding part is, we have lung transplants, heart transplants, liver transplants, things of that nature. And a lot of times in my experience working in the ICUs, they don't remember us. And so when they come back for a checkup and they're with a family member that obviously remembered everything that was going on at that time because they were so sick that they don't remember us, when they come back and they look healthy and I don't recognize them, I do not have a clue who they are, but I recognize the family member, and the family member reintroduces that individual to us. And they don't remember me, but they look at me like, thank you. Like, we did all this work, many, many, many hours of taking care of this person day after month, and they come back, they're healthy, and they're living a good life. That would be the biggest reward that you'll get out of this career.
Wow. Yeah, that sounds very, very rewarding. So what makes a good respiratory therapist? What skills, interests, and abilities do you need to possess to be good and enjoy this job?
Yeah, so this comes from Northwestern School of Medicine, and you know, basically what we need is we need somebody that's willing to work hard, they're nice, and they're smart, and all of those traits in that order. Working hard, nice, and smart. You need to be able to talk to your patients, be able to treat them with respect, understand that they're in a difficult situation in their life. um, that's the most important thing. Everything else, skills, education, that can all be taught, but we can't teach you how to be a good person and how to be a hard worker. That's my take.
Great, thank you. What are your future career goals?
um, so that's something I've thought about, and I'm not positive. There's many opportunities throughout the healthcare system, and you know for me right now, I'm happy where I'm at. I feel like we have a lot of work to do. We're still, trying to rebuild from the COVID pandemic, and keep everything moving. And just the healthcare system right now is really stressed, and there's a lot of need for good employees. And my goal is to kind of get get everything back to normal, and we're not there yet. So that's my career goals right now.
Thank you. If someone thinks they might be interested in becoming a respiratory therapist, but they're not sure, what could they do to learn more?
Yeah, so I'll be honest, I didn't know what a respiratory therapist was when I first pursued the career. I didn't understand it. I didn't know anything about it at that time. I didn't even. My sister is a bad asthmatic. Had no idea. I thought everybody was a nurse, and that's not the case. So to pursue the career, I would advise anybody. There's several of the city colleges that have this program. I would encourage everybody to reach out, talk to those individuals. Happy to talk to anybody myself, just so you can better understand what the future is of the career. Um, yeah, just use your resources. Talk to Malcolm X has a college, Rush has a college, or as a program, I should say. Um, St. Augustine has a program. Moraine Valley has a program. College of DuPage has a program. So reach out to those individuals. If you can't get answers or you need more answers, I'm more than happy to talk to anybody, just so they can understand fully what they're getting into.
Great, thank you. I don't see any additional questions in the Q&A or in the chat, but feel free. We're a small group, so you can take yourself off mute or raise your hand if you have a question. I actually have a couple of questions, but you want to kick it to you, JR, to see if there's anything that maybe we didn't touch on yet that you want to make sure folks know about.
Yeah, I think the biggest thing is understanding that there's opportunities outside of just being a bedside therapist. There's opportunities to be a leader, and that's throughout Chicago. We host 7 schools at our institution, and you know it's a good group. I mean, at our institution, this is I think 3-year-old stat now, but I did a kind of off the head looked at to see we're a very international group, and I looked at this, and no, not counting 2 countries in a row, our organization had in the respiratory therapy department 21 countries that people were born in outside of the United States. So it's a very diverse group, and you know, a lot of good people, a lot of good ideas, and a lot of things to bring to the table.
Great, thank you. So one of the questions I had was if someone is interested in like pediatrics versus adult versus like geriatrics, do you know, is that where kind of those specialty like the bachelor's and master's degrees come in, or is that more experience?
So it's more experience. It depends on what hospital you're at, depending upon what they do. So at the hospital I'm at, we have adult side and we have the neonatal ICU. Our neonatal ICU is a level 3 neonatal ICU. So if we go to deliveries, is basically that. So if a lady is delivering a child, we will go there and help resuscitate if needed. If a child needs a surgery, they go to Lurie's, which is right next door. So it's not whether or not you have an associate's, bachelor's, or master's. It's really what your focus is.
Okay, great. And do you think you could talk a little bit more about how you work with some of the other like clinical positions, doctors, nurses, and things like that?
Yeah, so it depends on which hospital that you're at and how they operate. You know, there are hospitals that are doctor driven, and the doctor basically says, "This is what I need. This is what I need you to do," and that's what you do. You don't necessarily have a voice. Some of the bigger major academic medical centers like Northwestern or a Rush or places like that, we have what we call evaluation and treat protocols. And what we do is like we evaluate the patient as a respiratory therapist, and then we communicate back to the doctors and let them know what does this patient actually need. And to put things into perspective for everyone that's actually listening today, um, so physicians get like a very small chapter on respiratory therapy. All right. And so that being said, I can tell them this is a machine, and they don't know the difference, and they don't need to know the difference. That's where you come in as an expert and are able to come in and say, this is what our patient needs. And they're likely going to say, okay, thank you. And that's what we do. Hopefully that was helpful.
Yeah, no, that was very helpful. I appreciate it. And I know you kind of touched on, how things changed a bit during the pandemic. But I was wondering if you could maybe talk a little bit more, and if it was just more the volume of patients you saw, or I know, there was a lot of breakthrough in therapy throughout the last couple of years. And so just kind of touch base a little bit about what you saw as changes during the pandemic in your field.
Yeah. So during the pandemic, when the pandemic started, like everybody, nurses, doctors, everybody was a little scared. We didn't know what we were getting into. We didn't really know what we were doing. And so what we did is we worked with a lot of teams out of, Italy and China and different places, and tried to figure out different care paths that we had for these individuals. And frankly, like I said, we didn't really know what we were doing. And we figured some things out as we went along, and we're able to better care for these patients and make things happen better, better outcomes, I guess. Uh, so what's happening now is the patients that are coming in are not necessarily COVID patients or flu or RSV or anything like that. They're coming in and they're just sicker. They're just more sick than they ever were before. And so the slightest thing makes them, feel even worse, or, require more care. And so that's really what we're up against right now. And that was one of the reasons that I actually got into the field, was when I talked to the director of the program at that time, almost 15 years ago. And I'm talking to this guy, and he's telling me, he's like, look, the people that are coming in are going to be sicker and sicker, which they were at that time. Now they're even sicker. So when they come in, it's a bigger deal. And, you know, it's kind of what we're up against now in healthcare in general. So yeah, it's not a good situation to be in, but the people require more acuity.
Yeah. But yeah, but there also seems to be a lot of advancement too, which is good, you know, as these people are coming in sicker. So it seems like a good field to be in.
Yeah, absolutely.
So I don't see any other questions in the chat or Q&A. Is there anything else that you'd like to add?
Yeah, I think the biggest thing would be, you know, healthcare is you're guaranteed a job. There's always going to be a position for you. You're guaranteed a decent income. Know that the health benefits are usually very good. And to be honest with you, it's very satisfying. It's a situation that every day when you go to work, you make an impact on somebody else's life. And the best way to look at, you know, healthcare is if you are treating a patient, keep in mind that they're sick and they're going to stay the night, most likely. You get to go home at the end of the day. And you make an impact on people's lives like you have no idea. And they, you know, if they do well, if things work out for them, they'll never forget your face.
Great. Thank you so much. I appreciate that. And all the information you provided. So the next steps is at, I believe at 5, there's going to be an overview of opportunity session to hear about internships, mentorships, and volunteer programs they'll be promoting, and then access to an exhibitor hall. If you fill out the event survey, you have a chance to win $100 Amazon gift certificate. And then starting tomorrow, you'll be able to log back in and get access to all of the recordings for all of the different job spotlights. So please check back for that. So I know we still have a little bit of time, so I'll just leave it open in case any questions come up. But just thank you so much for your participation. And yeah, that's it.